All right. Welcome back to the House Committee on Government Operations, Military Affairs. We are here after floor to hear a little bit more testimony about H-270. But before, as we're kind of waiting for our witness to come into the Zoom room, we heard testimony this morning from the secretary, and I wanted to have a quick read from the committee about how we're feeling about the 10 million and the $5 million one-time requests specifically that we've been asked to comment on by the Appropriations Committee. So Representative Chase, my sense of that was that there's a lot of merit in all of the updates in the 5 million and in the infrastructure work and the 10 million, but that it's probably not all going to need to be spent in this fiscal year. Is that a fair?
That's what I got out of it. I would support setting the funds aside, but Approps has their own bigger picture about what needs to go when and where. Secretary mentioned a check-in. I want to be clear, I don't think he suggested it, but he mentioned it as we've done with other projects, which would be
so would the
previous projects.
In addition to the items we discussed yesterday, would the committee be okay with me adding to our budget letter something to the effect that, we support the projects and initiatives that are bundled in, and that we should work to determine how much of those one-time funds need to be spent in each calendar year, but that we support the initiatives and look forward to working with them on when we need how much of the money. All right. If there's no objection to that, I will take that direction and add that to the list. Thank you so much. So Melanie, thank you for your patience. We had a very long floor debate. So I appreciate your flexibility this afternoon. And would be very interested in having you introduce yourself to the committee and share your perspective on the H-270, our Cannabis Control Board miscellaneous bill.
Great, thank you. I'm happy to be flexible. We always have our email inboxes to keep us company, right? So got a lot of work done today. Thanks all for having me. My name is Melanie Sheehan. I am the Director of Community Health at Mount Scottney Hospital in Windsor, Vermont. I was just recently appointed to Director of Community Health. Prior to that, I've been leading local and regional prevention efforts, substance misuse prevention efforts for quite a few years. And I've actually been at Mount Scottney for 20 years. In my new role as the Director of Community Health, I'm also involved in the Blueprint for Health, the project manager. I've been aware of the Blueprint since its inception. So understanding a lot of what it takes to do population health management, also working with One Care Vermont in healthcare reform efforts, and recently also received a master's in public health degree. So a lot of my comments today are really going to be focused around the public health lens, and I want to talk a little bit about that. I do want to mention that I am a vice chair to the Substance Misuse Prevention Oversight and Advisory Council. So my first point of consideration for all of you is the usefulness of this council. We were established by Act 82 by the Vermont legislature, and we're a multi-sector council of professionals who are advisory to the Department of Health. But we do submit legislative reports on an annual basis. We make recommendations around policy pieces, and would be happy at any time to interface with you all as a council of the legislature. So I'll put a plug in for the SMPC there, and I'll mention it again later. A point of clarification, just a question I have for all of you. I thought I was being asked to talk about H78 and 270. Is that correct, or did you just want me to talk about 270?
You are correct. I had deferred a little bit to Representative Nugent, who suggested you might be able to offer us a broader policy lens to consider as we delve into those two sort of buckets of bills that both have to do with substances and the way that we're regulating slash, allowing them to be sold and or promoted. So Representative Nugent had really advocated that we bring a larger public health perspective to our consideration of both of these bills. So yes, that's absolutely the case. I'm sorry, I'd forgotten that we had that.
No, that's okay. I just wanted to clarify, and yeah, I'm glad to have that insight, and I'll give you my thoughts on both of those bills, and then perhaps at the end we can circle back and make sure that I've met your needs. It sounds like we're all on the same page of wanting to clarify the public health lens. Generally, when we look at policy setting and decision making, they usually happen through two lenses. And we see this at the local level, regional level, and even at the state level. But there tends to be usually a business or economic standpoint, or a lens, or a person-centered lens, which is where you find public health. And what's generally popular, or by the people or for the money, often is contradictory to what's good for people. And so sometimes we work hard in collaboration with our business partners and find middle ground. But a lot of times in these proposals, we'll see that rub, or even in the industries, we'll see that rub between, well, this is what the people want. And we're like, yeah, but we want what's good for the people. So I will be talking today about that public health lens. And to be looking at socially responsible decisions or policies. So as a proponent of public health, we often ask people to consider a health in all policies approach. So in public health and prevention, we tend to follow a framework that requires us to think about health in a certain way and a process to do that work. So just going to walk you through that a little bit. Assessments are usually, we look at what data driven need is a policy attempting to address. So this really helps us to avoid decisions that make us, popular, or, it's a feel good approach, really trying to hone in on the data pieces. We look at capacity. Do we have what is needed to implement a change or a new policy and sustain it over time? And also, who's most impacted by a change, and are they involved in that decision making? The next steps are planning and implementation, which is, sort of the logistics piece of it. But then there's evaluation. And I think really considering, are we committed or committing enough research and financial resources to monitor the change that a policy will have on the health of people? And are we committed to change policies that are demonstrating harm? So, if you start with addressing a need, a data-driven need, you've got an assessment, it comes full circle around evaluation to say, well, this was the intended change, and we need to look at the data and see what we're having. So those thoughts all play into my mind, and that framework is sort of at the basis of my recommendations. So I just want to speak first to the H78, which is the alcohol policy. The bill is essentially asking the state to eliminate the sunsetting of a measure that was meant to support the restaurant and bar business during the pandemic shutdown. And this was a time when consumers were not able to frequent establishments. And I imagine there was a concern for keeping businesses afloat in Vermont. So that was a business decision, which was likely very much needed. Where we are now, obviously, people can attend whatever venue they want. They're unmasked. They have access to alcohol in whatever way that they want to partake. The impacts that COVID had on alcohol consumption have been studied, and they're not good. Increases in alcohol consumption first seen nationwide at the start of the pandemic continued through 2020. This has been studied by the National Institutes of Health and a survey conducted by RTI International. I have study findings. I'm going to sort of keep going, and maybe if you want to hear a little bit more about that data, we certainly can do that. Some of the data showed that survey takers were drinking alcohol to cope. Around 40 to 50% of people who responded were coping with stress of the pandemic. Compared to February 2020, the number of drinks consumed per month increased, as did the proportion of the population that was exceeding recommended drinking guidelines and binge drinking. And all of these trends in February 2020 were continued to sustain through November. The results of the study also showed that persons who were disproportionately impacted by these alcohol increases were women, persons who lived in household with young children, and those who identified as Black non-Hispanic. So after the onset of the pandemic, there are other studies that show Americans drank more frequently, and the deaths due to a narrower set of causes attributable to alcohol rose 25% from the previous year. And I have all the citations for these. I can provide afterwards links that you can do some of this reading. It's also worth noting that nationally, about 40,000 people die annually from alcohol-related deaths than die of overdose. So much of our attention has been paid to the overdose epidemic, just simply sometimes, I think, because alcohol use is more socially acceptable. But in the single year of 2020, the alcohol-involved death rate increased 26%, and it was comparable drug overdose death also grew by 30%. So it's very close. So we tend to forget about alcohol just because it's more socially acceptable. I guess in summary, I would say that passing H78 or repealing the sunset of off-premise alcohol consumption increases access to alcohol. It is counter to the suggestions of best practices to curb harms associated with alcohol. In one of the JAMA articles cited, they conclude that a greater implementation of alcohol-based policies can reduce the proportion of alcohol-attributed deaths. And the CDC recommends that raising alcohol taxes and regulating the number and concentration of businesses that sell alcohol does help to curb harms. Obviously, increasing or continuing to keep access to curbside or off-premises alcohol is expansion, and it is increased access. So from a public health approach, I would suggest that we take the health in all policies approach, study the impact the alcohol is having on the health and health disparities of Vermonters before deciding to indefinitely allow this to continue. I did want to again highlight that these studies from alcohol use and COVID do have very clear health disparity metrics or outcomes. So, and I think we're in a time right now where we're very much considering health equity and health disparities. And it's really something that we need to pay attention to. So those are my thoughts on H78. I don't know if you want me to sort of roll on into the other and take questions all at once, or if you want me to just take a pause. I tend to talk a lot, so.
No, that was great. I think committee, I think your advice for us on H78 is very clear and is a different perspective than the ones we've heard so far. So that's very useful. Do folks have questions for Melanie? Representative Murowicki.
Thank you for coming and sharing with us. Just to reflect what I think I heard in regards to what I understand from my prevention work with kids, that alcohol is still the most prevalently misused and dangerous drug out there.
I don't believe my talking points were specific to kids. Right now, I think that's true for all populations. Alcohol is the #1 preventable for adults and youth. I know right now in Vermont, we have a very close, cannabis and alcohol in youth are pretty even. But I wasn't specifically talking about youth specifically.
What about for adults?
Yeah, for adults. Yep. Yeah, I have a citation on that somewhere. I'm just not going to pull it up really quickly.
Thank you.
But yeah.
Representative Waters Evans.
Thank you. Thank you for pulling all of those figures together quickly and that information. I would believe it 100% about the increase in, but I guess my question specifically relating to H78, which is the act of purchasing the alcohol and then bringing it home in a container. can you explain to me how that increases the availability of alcohol? I guess I'm not quite understanding the correlation between something that's for sale inside a restaurant already and just removing it, and how that factors into the increased alcohol use and increased negative impacts that we saw during COVID.
Well, and it's my understanding that this bill came into play during the pandemic for the curbside access. Is that correct?
Yes.
So I don't know that we have specific data on, like, to your point of, taking it home, but overall, these policies were passed during the pandemic. And during the pandemic, we saw these really detrimental impacts to health outcomes during the pandemic because of these policies and people drinking more for coping. And so I guess my viewpoint in preparing these talking points was just kind of coming from, I guess I'm not understanding the impetus behind repealing the sunset when, right now there was a lot of emergency orders that allowed people increase access to housing or increase access to food. And, locally we're doing our best right now to help most vulnerable Vermonters face the end of other emergency executive orders related to key things like housing and food, because there's recognition that we can't sustain those pandemic level policies. So I think my talking points are really around, if we set this policy up during the pandemic, why do we feel like there's a need to keep it going when we're clearly seeing the negative impact of, increased access to alcohol? I mean, it's obviously, if you go out to dinner and it's just, I think this policy is allowing people to take alcohol with them, perhaps where they where they weren't taking, and perhaps I misread the bill wrong. I honestly don't know. I guess yeah.
I think, Melanie, that you've got what the bill does. It will allow people to continue to take a beverage home. I think the thing that we will discuss, and I don't think we need to belabor the debate here, because we are going to have it, I think, on this bill, is whether there's data, there's clearly data that people were consuming more alcohol and that folks were using other substances as well at a higher rate. People were also facing unprecedented stressors. There was a lot of other factors going in than just policies like this specific one. So teasing out the public health impact of the specific one is very hard for us as citizen legislators. And so, we're trying to hear the caution that you're bringing with your professional perspective about just expanding the availability. And so I think what I'm hearing loud and clear from you is that, in general, expanding the availability of alcohol with policies like this is one of the things that can increase consumption. Is that a fair thing to take away from your testimony?
Yeah, I think so. But also, again, it's related to the pandemic in that, like, if people are done drinking at a restaurant and they want to go to a liquor store and buy more drinks, they certainly can do that. I guess I don't see the need. I would caution, if we think about this, any policy through a health and all policy approach, I'm trying to understand, what is the need? What is this bill attempting to respond to? Like, where's the data? What are people saying they don't have? Like, why are people thinking they need to still have this when all of our other pandemic or all of our other alcohol access points are back in play? The pandemic is over. So I'm not really sure why. I don't really know why there's advocacy to keep this going, unless it's just convenient for people to drink more, which I don't think is the right public health approach. So I think we're all on the same page on where I'm coming from.
Any other questions about H78? I think I would like to have Melanie comment on H270 and acknowledge that we will be coming back to these particular questions on both of these bills when we come back from the town meeting day break. So I don't want us to get too much into too bogged down in the debate. I want to hear Melanie's perspective. So thank you.
Just say one thing.
Oh, yeah, sure.
Just one thing on pandemic practices. Yes, there are different approaches to how we deal with housing vouchers. There are different approaches of how we're dealing with some of the other public supports. But I think one thing that's differentiates those from this is those were state programs with taxpayer dollars. This is not. And I think as we do shift away from the pandemic and different standards and protocols, I think that just the example of you giving testimony on Zoom is a wonderful example of a pandemic practice that held over.
True. Truth. I'm not bashing all pandemic practices, just to be clear. Just the ones that increase alcohol.
Some things, yes, we did some things. We move on from some things.
We also probably learned some things that we like that we wish would go away now. And that's maybe, that's
right.
Part of what we need to consider. So
it's constantly evolving.
Right. Yeah. I mean, honestly, it's also important that we recognize that alcohol is an equally concerning public health issue with opiates, with other addictive medications. And, we could do better, I think, as a society to pay equal attention to alcohol use disorder as much as we look at opioids and other things. So it's more of a health concern than gets airtime. So. But with that, I will move on to the H270. This bill was harder for me. It's sausage, if there ever was sausage, I would say. So again, I'll maybe speak a little bit broadly on this. Vermont's retail cannabis market is less than 6 months old, so to speak. What we're seeing right now is pioneer states like Colorado, Washington, California. They're currently working just as hard as all of you are this legislative session to put more regulations in place after living with the market for over 8 years and seeing public health impacts. Currently in this legislative session, we have 8 bills related to cannabis. At least half of those have some component that's concerning to us from a public health perspective. As I spoke about alcohol, I would advise we look at those bills through a health and all policies approach. I think that we have a need to be strategic and intentional. I think that this is going to take time. And I don't know that we really need to rush into anything as we're seeing these other states trying to put more of the brakes on what they've been doing because they're living with the impacts. And our market is still pretty new. So Vermont has just released a Department of Substance Use cannabis data pages, which shows that since legalization in 2019, there's been some health data that's released now. We see that Vermont adults have significantly increased cannabis use between 2013 and 2019. Frequency of cannabis use has increased significantly from 2011 to 2020. 65% of people using cannabis in the last month have done so 10 or more days within that month. That was 44% in 2011, so a 21% jump. There's some hospital data, and again, I'm not going to read you all the stats. I can send this to you, but there's hospital data that shows inpatient hospitalization for cannabis hyperemesis syndrome significantly increased, as did the annual rate of emergency department visits for cannabis hyperemesis syndrome. Poisoning data, calls made to the New England Poison Control Center for cannabis exposure increased tenfold from 2012 to 2021. Cannabis-related poison center calls among Vermonters between age 0 and 19 increased from 2 to 26. 2 calls in 2012 to 26 in 2021. In recent years, people between the ages of 0 and 5 had the highest number of poison control center calls. Treatment, we're seeing the number of Vermonters accessing treatment for cannabis use disorder has decreased So we just sort of overall, we know that cannabis is addictive. It's an addictive substance. It does result in some harms. The data that I just read off or that's in this report shows that Vermonters are using it more than before, using it more frequently, and not seeking help when they're using it to a point where it might be a negative factor in their lives. And we also see people who shouldn't be exposed being exposed. So this is not to say, you know, I think there's a lot in this bill. I'm actually, you know, I think our cannabis regulatory system to date has functioned pretty well. The CCB has been a collaborating partner with the Substance Misuse Prevention Council, with VDH, with my peers in prevention. We actually worked together to draft the point of sale flyer. You know, I understand that they're making decisions based on a business model, and sometimes we agree, and other times we don't. You know, we just keep collaborating and trying to provide that health lens. So specifically speaking to 270, there's measures I would agree with relating to the CCB. We should be testing our products. We should ensure quality control. You know, that's a health production strategy, and there's some pieces in this bill that speak to that. I would just say our system is way too new to be advocating to doubling the milligrams of THC or to increase the amounts of cannabis allowed to be grown until, you know, again, you know, until we can be certain that these policies are needed to address a particular data supported concern. We can't change the rules so quickly without a rationale or without having time to assess the impact of what we currently have. And we haven't, you know, we have no time under our wings. We haven't even lived with what we decided the market should have, and now we're already trying to increase it. And I will again advocate to say, while states who are much, much more advanced are, we're actually the apple of other states' eye by having some of the regulations that we do, like the caps and like the limits on the caps on the milligrams and things like that. So, you know, overall, my message is just to pump the brakes a little bit. Let's have a science approach. Let's not be changing removal of potency stuff or increasing milligrams or.
Yeah, and to be clear, Melanie, I just, because there's been a lot of confusion in some of the committee conversation, I'm sorry to interrupt you. There's nothing in this bill that changes the potency limits or the serving limits on cannabis. I was very clear with the Cannabis Control Board. I do not want to touch those really hot issues.
Okay, you do have a packaged product to have a maximum of 100 milligrams. That's a double, right?
Yes. So yes, that. Okay. So I was just about to ask. One of the things that has been vexing this committee for years, as we've considered this, is this particular limit, because I and others, including the Cannabis Control Board, have yet to be satisfied that there's any real public health benefit from allowing somebody to take away two of the exact same container that has 10 gummies in it each versus putting 20 gummies in one container. So I've been trying to really try to get at what is the real public health benefit of that. It continues to be something that I understand generally what the concern is about the amount of THC kind of available total. But I have yet to be convinced about the danger of having 100 milligrams worth of 5 milligram gummies in one container versus 50. So I don't know if there's, from the poison control data, if it's really about the amount of gummies in a container, or other edibles in a container, if that has a particular public health benefit. We really don't want to make a rash decision. This is something that's been debated before in this committee. And so it's definitely one of the key things in this bill, because it is one of the only changes in this bill that is about being more permissive. Everything else on the regulated adult use market side is about, the mechanics of the board itself and fees and things that I don't think have a direct public health impact.
Yeah, honestly, when I look at potency percentages and the milligrams and the equivalents, like my head spins. That's not my world. But
Fair enough.
I mean, I just want to say that, if it's hard to wrap the mind around and you don't have the data and you're not convinced yet, for me, again, from a public health science point of view, is let's leave it as it is until we know for certain, what the deal is. Or is there another, I'm certainly not the subject matter expert on the milligrams and the percentages and all that. I can say that, the average THC content of products increased significantly over the last 50 years. There was 2 to 3% THC, which means an average joint contained, 10 milligrams of THC. And now we're talking about 10 times that. So from the Poison Control Center, the calls, we are seeing education alone is not enough to prevent accidents from happening. So if there's any policy that you can implement that is just preventing the amount of toxicity that someone is exposed to, I think that's a lens you can look through. But clearly this bill is asking for an increase, and again, we've only been a market for less than 6 months. How can we possibly be advocating for an increase when we haven't really lived with what is the impact going to be of the 50 milligrams? So that's just kind of how I look at it. Maybe it's oversimplified. Again, I'm just I didn't have a lot of issues with this 270 except that one thing, and it sounds like you all are feeling the same thing. So I'm not really sure what the rush is or the intention is here. I haven't heard from the CCB about this issue per se. So I'm perhaps not as prepared to talk about it as you thought I might have been, but.
No, but I think you've offered us a useful frame for both of these bills, Melanie. I really appreciate you being willing to sort of weigh in with a broader lens on a couple of bills that have details that are way down in the weeds on specific policy. But I think you've helped us have another way to think about them and weigh them. That's important. Are there other things you want to leave us with before we kind of had to wrap up?
No, well, there is one thing, and I know it's not appropriate for this committee, but I don't know if you have cross collaboration. I do hope that the SMPC is prepared to talk about Senate Bill 72 and the THC potency cap repealing. And, I hope if at any point it's, if anyone wants to hear from SMPC, we have key data points to share on that. And again, I know that's probably not this committee. It's probably not all of you as decision makers, but
if it passes the Senate, it'll come this way. And I very intentionally did not want to go anywhere near that. That's like the third rail of cannabis debate in this building.
Yeah, I'm not touching it today.
But it is relevant because if it passes the Senate, we'll get it. Representative Murwicki.
Thank you so much. This has been helpful today. You mentioned some reports and research. Can you share that with us?
Yeah, I was sort of planning on putting all of this, these statistics that I've teed up. There's a lot of percentage points and stuff I didn't share because I didn't want to take up too much of your time, but I can certainly email that to Andrea, and I'm guessing she will get that all to all of you.
Thank you. Very helpful.
Okay, great. And I don't know, Andrea has my email as well. Unless you want me to pop some links in the chat, I can do that, but I don't know if that's the best way.
If you send any information, whether it's links or specific documents to Andrea, we'll get them posted under your name on our committee website so that we can refer back to them as we look at both of these bills.
Okay, that's great. I will spend the next few minutes teeing up that email. So thank you all for your time.
No, thanks for being with us this afternoon.
Yeah, I hope I met the goals, and thank you, Representative Nugent, for having me come. So it's always a pleasure.
Really appreciate your time and flexibility. So committee, we have worked very hard this week and today especially. I thank you all so much. We're going to adjourn and go off live. Melanie.